I've recently had quite a few patients come to our clinic who suffer from BPPV, which typically manifests as intense dizziness or spinning sensations. If you've recently experienced severe vertigo, then this video will help you identify if it is BPPV and, more importantly, what you can do to treat it. Hi, I'm Dr. Alex and I'm a doctor of chiropractic. BPPV stands for benign paroxysmal positional vertigo. It is a common disorder of the inner ear that leads to episodes of dizziness or vertigo when there are changes in the head's position. It is often described as a feeling that the whole room is spinning. Certain head movements or changes in position, such as turning over in bed, looking up, or tilting the head back, can bring on vertigo in individuals with BPPV. BPPV is typically caused by displacement of small calcium carbonate crystals within the inner ear. These crystals, normally embedded in a gel-like substance, can become dislodged and migrate into fluid-filled semicircular canals of the inner ear. When the head is moved in certain positions, these displaced crystals can stimulate the inner ear, leading to symptoms of vertigo. So how do we diagnose BPPV and how do we know which area is affected? We can diagnose it through a clinical orthopedic test called the Dick's hole pipe maneuver, and this is something that you can do yourself. Sit on your bed so that your head will hang over the edge when you lie down. Turn your head to the right and lie down quickly. Wait 1 minute. If you feel dizzy, the right side is affected. If you don't feel dizzy, sit up, wait a little bit, and repeat the test on your left side. If you feel dizzy when you repeat the test, your left side is affected. If you've managed to conclude that you are suffering from BPPV, I will now show you how you can successfully treat it in an instant. Treatment for BPPV is typically highly effective and often involves maneuvers designed to move the displaced crystals out of the semicircular canals. Just make sure that when you do these movements, you're in a safe place, like on the ground or on a bed that's big enough so that you don't fall off. Also make sure that you have a trash can nearby, just in case that you have to throw up. Now do each of these movements for approximately 30 seconds or until the spinning stops. So what's going on with these position changes? Essentially, the head has moved in such a way to manipulate the crystals fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle in the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back in the wrong way and the maneuver will fail. It is also important that the head positions are angled correctly, or else the crystal will not settle into the correct position in the canal. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from the lack of momentum, and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV. So if you believe that you do have BPPV, be sure to try these movements. If symptoms still persist, be sure to book an appointment with your local chiropractor who can help you with these movements as well. But if you are able to do these movements, then trust me, your head and dizziness will thank you for it.